Pavla Broadhead. I'm a family nurse practitioner and owner of Hearthside Medicine Family Care. We are a primary care clinic located here in Bend, Oregon, and we offer integrative medicine, so blending traditional conventional medicine with more naturally minded approaches to care to treat the whole person rather than just the symptoms or the disease. Today I want to talk to you about something that I frequently encounter in primary care. I also encountered it when I worked in urgent care and ER. It's called endometriosis, and you might be familiar with endometriosis if you yourself have ever had very severe painful periods or know someone who has. So what is endometriosis? Well, endometriosis is a condition where the cells of the uterus, the endometrial lining, implant in places that they should not implant outside of the uterus. So they might implant, for example, on the bladder, the intestines, inside the peritoneum of the abdominal cavity. They might implant on ovaries and fallopian tubes and even the rectum. And when this happens, just like the regular endometrial tissue inside of your uterus, this tissue that's outside of the uterus responds to estrogen when you're about to begin your cycle. And what this means is it becomes inflamed and swollen, and it bleeds, and it can cause scar tissue called adhesions. And these scar tissues, these adhesions, can even happen between organs, where organs will adhere to one another. So this can all result in really painful periods before or during and sometimes in between your cycles. So how is it diagnosed? Well, endometriosis is typically diagnosed clinically, not necessarily through a biopsy, though that is the gold standard to make the official diagnosis of endometriosis. But it can be diagnosed by just coming in and talking with your provider. And for example, I'll often see someone and find out that they have a history of these very severe painful periods, maybe problems with fertility. I might order an ultrasound to look at the uterus or the ovaries. And then from there we would go forth with a diagnosis of endometriosis. And the way that we can treat this differs. So we can do conventional medicine treatment, or we could do more of a naturally minded alternative treatment. So the conventional treatment is what I'm going to talk about in this first segment today, and then I'll follow up with a second part where I'll talk about the alternative treatments. So for the conventional, it's typically anti-inflammatories such as ibuprofen and Motrin, hormonal therapies such as birth control pills, or for example IUDs like the Mirena IUD. There are some other medications that can also be used. Additionally, there can be a surgery called a laparoscopy that can be done, but it's important to note that often folks will have return of their symptoms 2 years after the laparoscopy. And then as a last result, there's hysterectomy that also involves typically using removing the ovaries to help cure endometriosis. But this is a really important decision to make, because obviously once this is done, you cannot have children. So that decision needs to be taken very seriously and made with your medical provider. So that's part one on what endometriosis is and some of the conventional modalities. Stay tuned, please, for part two for the more naturally minded modalities. And please feel free to shoot me questions if you would like on our website, hearthsidemedicine.com, on our Facebook business page, or follow us on Instagram. Thanks, everyone. Bye-bye.